Hello everyone, delighted greetings from the Yenapoya Deemed to be University and a greeting from the Center of Ethics from Yenapoya Deemed to be University. I, Dr. Mudasir from Yenapoya Deemed to be University, work as Assistant Professor in the College of Physiotherapy and I'm the teaching faculty for the Center for Ethics. As I'm trained for ethics from the Center of Ethics, which is in collaboration with the Gothenburg University, Germany. Today I'm dealing with the topic ethical approach in research. What are the ethical considerations which have to be considered while we take research? So as we all know what research is, so I'll just give you a brief definition about research. As we take a research for a human participant, it is the primary purpose for research is discovering, interpreting, and then development of methods and systems for the advancement of human knowledge. This is a definition of research. So when we do research, how many of us know what are the ethical considerations we have to look into when we take a research? So being a researcher, it is very important for us to know how ethics has come into the existence, what were the ethical issues faced in the research, and how the ethics has set up a guidelines, that ethical guidelines to conduct any sort of research. I'll be taking you to the Second World War period, which was from 1939 to 1945. Many disturbing human research and experiments were conducted by the doctors and the researchers during that period, and those doctors are called as doctors for hell. So you all must be wondering why those doctors or scientists, those who have conducted research, are called doctors from hell. It was an experiment which was conducted on Nazi population. Nazis were called, were the German people, those who were called as Nazis. So there is a horrific account of Nazi experiments on humans done by those doctors, which were called as doctors from hell. Between 1939 and 1945, at least 70 medical research projects involving cruel and often lethal experimentation of human subjects were conducted in Nazi concentration camps. So all these researches, Nazi experiment research, were conducted on the prisoners and in the camps that is called as Nazi concentration camps. And in Nazi experiments on humans, accounts in vivid, objective detail. It was a horrific human experiment conducted by 20 so-called physicians and medical assistants in Germany under the direction of Nazis. So that is what it is called as Nazi experiments. In Nazi experiments, the human experiments were done, including high-altitude experiments, where the Nazi prisoners were forced without oxygen to be in the high-altitude concentration camps or the chambers, and those chambers which duplicated the high altitude of around 68,000 feet. So those prisoners were forced to be there without oxygen. And even the prisoners were done. There was a removal of section of bone, muscle and nerves, including whole legs, removed at the hips to transplant to other victims, and it was without anesthesia. Artificial wounding and exposure to mustard gas was administered to those prisoners. Wounding of two limbs and treatment of one but not the other with sulfonamide antibiotics, intramuscular injections with fresh typhus. So these were the brutal and lethal experiments done on the Nazi prisoners, which that time no ethical considerations were taken into the considerations. So the voices of the victims, we cannot call them as the participants, we call them as the victims because they had not given any consent to be a participant in the research. They were forcefully taken for the research to take a part into the research. And if you see the first picture, some experiments were done on people, on population of prisoners, where they were immersed in icy water to see the freezing point. And some were given the injectable sulfonide injections and to Some experiments were done where the limits of human endurance and existence at extremely high altitude was investigated. The victims were placed in a low pressure chamber and therefore suddenly our stim was raised, altitude was raised suddenly. Many victims died as a result of those experiments and many suffered a grave injuries, torture. Even the studies was done on the twins where the injectable dyes injected into the twins to understand their unique genetic similarities. So these all were the brutal and lethal experiments which were done by so-called the doctors called as doctors from the hell, called as Nazi experiments, and which were done by the 20 physicians. If you see this picture, these are all the physicians, those who were involved in the Nazi experiment. And after this brutal experiment, which was going on in Nazi population, that is Nazi prisoners, there came a code called as Nuremberg Proceeding Tried Code, which was done by the American Nuremberg Military Tribunal in 25th October 1949. In response to this gross violation of human rights by physicians, the Nuremberg Military Tribunal, which investigated and prosecuted and perpetrators of the Nazi war crimes, established 10 principles of ethical conduct in medical research in 1949. So in 1949, they gave the 10 ethical principles which every research has to follow to conduct any research, called as Nuremberg Code. The Nuremberg Code is a set of research ethics principle for human experiment which was set in 1939 to 1945 after the Nazi experiments were conducted by the Nazi doctors. So as the Nuremberg Code in 1947, this came as an ethical guidelines for biomedical research where we have human participants. This consists of the voluntary consent of the human participant, that any human, which is whoever is taking part in any research, has to give the voluntary consent to take part in the research. The experiment should be as to yield fruitful results for the good of society, and the anticipated results will justify the performance of the experience. The experiment should be so conducted as to avoid all necessary physical and mental sufferings and injury. The degree of risk to be taken should be never exceed that determined by the humanitarian importance of the problem to be solved by the experiment. These were the ethical guidelines put for the biomedical research by Nuremberg Code in 1947. The experiment should be conducted only by scientifically qualified persons, and during the course of the experiment, the human subject should be at liberty to bring the experiment to an end if he or she has reached the physical or mental state where continuation of the experiment seems to him or her to be impossible. So these were some certain 10 ethical guidelines given by the Nuremberg Code to conduct any research on human participants. But still, the research was going on very unethical way. So I am not sure how many of you have heard about the Henrietta Lakes, called as HeLa Cells. She was a black tobacco farmer from southern Virginia who got cervical cancer when she was 30 years of age. In 1951, a young mother of 5 named Henrietta Lakes visited the Johns Hopkins Hospital complaining of vaginal bleeding. And upon examination, the renowned gynecologist of Johns Hopkins Hospital, Dr. Howard Jones, discovered a large malignant tumor on her cervix. At that time, the Johns Hopkins Hospital was only one among the few hospitals to treat poor African women in Virginia. So this Johns Hopkins University, there was another doctor called as Dr. George Gay, who was treated at Johns Hopkins University, where a doctor named Dr. George Gay snipped cells from her cervix, from Henrietta Lake's cells from her cervix, without telling her. The consent was not given. The information was not given to the Henrietta Lakes that her cells can be snipped from her cervix. So Dr. Gay, who was a scientist, discovered that Henrietta Lake cells could not only be kept alive but would also grow indefinitely. So Dr. Gay found that Henrietta Lake's cancerous cells, they were kept alive for years and years together, and they were growing indefinitely with enormous number. And he got the name of those cells as HeLa cells. For years together, Dr. Gay, he was a prominent cancer and virus researcher, has been collecting cells from all patients who came to the Johns Hopkins Hospital with cervical cancer, but each sample quickly died in Dr. Gay's lab. But he would soon discover was that Henrietta Lake's cells were unlike any of the others he had ever seen, where other cells would die, but Mrs. Henrietta Lake's cell doubled every 20 to 24 hours. Many scientists worked on Henrietta Lake cells, and one scientist estimated that if you could pile all HeLa cells ever grown once onto a scale, they will weigh more than 50 million metric tons, an inconceivable number, given that an individual cell weighs almost nothing. The another scientist calculated that if you could lay all HeLa cells ever grown end to end, they would wrap around the Earth at least 3 times, spanning more than 350 million feet. In her prime, Henrietta herself stood only a bit over 5 feet tall. So these all research scientists were investigating on Henrietta's cells, and without taking her consent, that they have snipped her cells from her uterus and they are doing research on her cells. Henrietta Lakes were part of research in the genes that cause cancer and those that suppress it. They help to develop drugs from treating herpes, leukemia, influenza, hemophilia, and Parkinson's disease. And they have been used to study lactose digestion, sexually transmitted diseases, appendicitis, human longevity, mosquito mating, and the negative cellular effects of working in sewers. So you all can imagine how Henrietta Lake cells were used in the research, have been generated money, millions of dollars by the researchers and by the drug companies to make the drug, to validate the drug for the certain conditions, which I have already mentioned. Henrietta Lakes died in 1951. The tumor that killed her has been alive and growing to this day. The tumor is immortal and was used to progress the polio vaccine and is the jumping point for most human cell research. So I don't know whether you all know that Henrietta Lake cells are the cells which are used for the progress of polio vaccine as well. Today, using samples is a very important part of doing cells on research or research on cells, but that was not something doctors worried about much in 1950s. So they were not terribly careful about her identity. When some numbers of the press got close to findings Henrietta's family, the researcher who had grown the cells made up a pseudonym, HeLa Lake, to throw the media off track. So if you see the picture at the right side, this is Dr. George K. and Mrs. Henrietta Lakes, and down if you see that it is Henrietta Lakes family. Henrietta Lakes family was from a very poor background where even the family members don't have the insurance, health insurance. So if you see the ethical point here, how doctors and the scientists have generated the money from HeLa cells. They have generated millions of dollars from her cells, but no profit was given to the family and no profit was given to the to the family, and no justice and no autonomy, no dignity was given to the Henrietta Lakes. Lake's family, however, did not know the cell cultures existed until more than 20 years after her death. Her cells were commercialized and have generated millions of dollars in profit for the medical research and patented her tissue. Her tissues were patented also. Researchers generated millions of dollars, and medical research are also in profit, but her family was not given any profit and they were not given any justice, and the autonomy was not considered. That is, the self-respect of the Henrietta Lakes was not considered in this research. When we go to the next research, which was also conducted very brutally, and it is called as Tuskegee syphilis experiment. Tuskegee study of untreated syphilis, it was conducted in the Negro males, which was a clinical study, and it was conducted between 1932 and 1972 by the United States Public Health Service in collaboration with Tuskegee University, a historically black college in Alabama. The African American men in this study were only told they were receiving free health care from the federal government of the United States. And according to the Centers for Disease Control and Prevention, the men were told that they were being treated for bad blood. For these men, 399 had latent syphilis and 201 did not have the disease. The men were told that the study was only going to last 6 months, but it actually lasted 40 years. So you all can see that what are the ethical issues in this research was Negroes were taken, the vulnerable population was taken here for the study, and they were lied saying that it is a bad blood what we are taking from you and we have a free health insurance for that. And it was told that the study will be conducted for 6 months, but unfortunately this study lasted for 40 years. The 40th Tuskegee study of untreated syphilis in the Negro male study was a major violation of ethical standards. The researchers knowingly failed to treat patients appropriately after the 1940 validation of penicillin. In 1914, the researchers found an effective cure for the disease that is called as syphilis. They found a valid drug called penicillin, but still this drug was not administered because they want to see the effect of the syphilis patients, those who were left untreated. So this was a major violation of ethical standards in this study called as Tuskegee study. If you see the picture here, Eunice Wardell, she was an African American nurse who worked in state of Alabama, was involved in this study, and Dr. Eugen Herot, who was a junior American physician and head of the John A. Andrew Memorial Hospital at the Tuskegee Institute in Alabama, who was also involved in study. It is very brutal study which was conducted on male Negroes in Alabama. And the movie also has come up. If you see at the right side of the slide, there is a movie called as Miss Evers' Boys. If you find time, please just watch this movie. It is completely about the Tuskegee Tuskegee syphilis study, how it was conducted. So I request all of you, please find time to watch this Miss Evers' Boys movie. After these brutal experiments, there came a report, Belmont report. First, the study was conducted and research was conducted in Nazi experiments, which was in brutal and cruel and lethal experiments done on the vulnerable population prisoners. And later on, the Nuremberg Code came. But after coming the Nuremberg Code also, that certain ethical principles were set, or it was an ethical guidelines for biomedical research to be considered whenever any human research has to be taken. But still research was going on. 40 years Tuskegee study was going on. Later on after 1972, the Belmont report came, which was written by the National Commission for the Protection of Human Subjects of Biomedical and Behavior Research. So it's an ethical principle and guidelines for the protection of human subjects of research, which every researcher has to know before conducting any research, which is called as Belmont report, which consists of 4 principles which every researcher has to consider while taking the research. Now, coming to the Belmont report, as I already said, that these are the 4 principles which every researcher has to take into the consideration while conducting any research. First one is the autonomy, that is nothing but the respect for the person. That is, whenever we take any research, it is not only of the research, when we take any patient for the treatment, the autonomy and the dignity of the person has to be considered. The consent for the treatment and consent to take part in the research is also very important part of a Belmont report. Second one is the beneficence, that is the benefit. If we are taking any participant in our research, whether the participant gets any benefit from our research, and the non-maleficence, that is no harm. We should not give any harm to the patient. There should not be any harm. But if we conduct any sort of research I don't think so. There is no harm. There can be any harm, that is minimal harm, or which can be sort of mental harm or emotional harm, which can be taken care, but there should not be extreme harm or major harm to the participants or the patient, whoever comes to our clinical practice, or participant, whoever is participating in our research. The fourth one is the justice. We have to give the justice to all the participants. If we have been benefited from the study, and those participants should be benefited from the same, and the justice should be given. As I have given an example of the Henrietta Lakes here, I correlate that study over here. As the researchers snipped cells from her cervix, and they generated millions of dollars, but no benefit, no justice was given to the Henrietta Lakes, and no autonomy was considered. First thing we can consider, the ethical issue here is the autonomy. There was no autonomy taken from the Henrietta Lakes to snip the cells from her uterus. The second one is benefit. She was not given any benefit out of this. As the society was benefited, medical research is benefited, researchers and the doctor generated millions of dollars from her cells, but no benefit was given to her or to her family. Non-maleficence, yes, risk. We can say there was no risk given to her, but yes, we can say yes, minimal risk was there, because it was an emotional risk. It was not a physical risk, what we call as emotional, what her family faced after her death. Family faced the emotional torture, what we can say, that it was a non-maleficence that can be considered here. The justice. The justice is that the family was from a very poor background. They don't had even health insurance. They were not, to bear the treatment for the family, but from Henrietta Lake cells, millions of dollars were generated. So these are the four principles which every researcher should know before conducting any research, and these research should be conducting on basis of the ethical guidelines, that the ethical principles of biomedical research. Now, autonomy, when we discuss about the autonomy, it is a willingness and agreement to undergo a medical intervention on research. If you see what is autonomy or what is informed consent, there is no legal definition of informed consent. Yes, under section 13 of the Indian contract law, it is defined as two or more persons are said to consent if they agree upon the same thing in the same sense. That is the definition given by Indian contract law under section 13 for the informed consent or autonomy. How is consent viewed? It is a permission, principle of respect for autonomy. It's a contract between the service provider, that is obligation, and the patient. In consent, there should be no force. We cannot force the participant to take part in our research. There should be no pressure. There should be no lying. Whatever you are doing in the research, you have to explain each and everything in the informed consent and the participant information sheet to the participant. There should be no fraud in the research. The doctors only proposes, and it's patient who wants to choose or no. It's a free choice of the patient. What to inform? When we are giving an information, what we have to inform to the research participant? It should be, the information should be very simple. It should be in a simple language which a participant can easily understand. We have to explain about the condition to the participant, what condition we are doing. Suppose, for example, I'm taking a research on cerebral palsy, and I'm explaining it to the patient's participant's father or mother. They should know the condition. Yes, I'm taking a study on cerebral palsy, and in simple language, in the simple terminologies, the thing should be explained to the participant or to the parents. Procedure. What procedure we are doing in this study? What are the prognosis? What are the benefits and significant risks? What are the additional procedures? What are the other treatment options? Cost, duration of admission, and post-operative management. These conditions, procedures, prognosis, This is applicable for treatment also. It is not only applicable for the research. When you take any participant for the research, yes, when you're taking any patient, the one who comes to your department, the one who comes to your OPD, or the one who comes to your clinical practice, it is your duty to explain all these before you start your treatment and to get the consent from the patient or the participant. Who should take the consent? Yes, a doctor can take the consent, a postgraduate can take the consent, a junior or the senior resident can take the consent, and an intern can take the consent. It is to be safe whenever we conduct any research. Many research nowadays, if you just see many researchers, still some researchers are going very unethical way. And if a researcher or if a participant is giving any claim or putting any legal claim on the researcher, so researcher is in trouble. And we have seen many cases where the doctors are treating patients in their clinics, and later the doctor is sued and the doctor is behind the bars. But to be safe, when we have to be safe, we have to consider the ethical considerations in case of research or in case of our clinical practice. So with this, I conclude my presentation. I would like to show our faculty from the Center of Ethics, we are deemed to be University Mangalore, where we conduct many ethical courses and under our director, Dr. Veena Vaswani, and our institute, that is Center for Ethics, is in collaboration with the Gothenburg University, Germany. Thank you for your listening, and thank you so much for your valuable time. And if you have any questions, I'll be happy to answer your questions. Thank you so much. Thanks a lot for listening to me. And thank you so much. Stay safe, stay home. I wish you all the best, and I hope that this presentation will really is very effective, and you will all, whoever is taking research in future, will consider the ethical issues, and whoever is in clinical practice or working in hospitals will consider the ethical issues of a participant or a patient. Thank you once again. Thanks a lot. Stay safe, stay healthy, stay home.